So my topic was insomnia, and basically just said this topic because it interests me, and my dad also has like issues sleeping. So what it is it's a sleep disorder, and where someone has trouble falling asleep or staying asleep. There's a couple different types, including acute insomnia. So this is where it's like just a brief time that you experience insomnia, and then chronic is long-term insomnia, and then comorbid is psychiatric symptoms. So this could be like linked to substance abuse or anxiety disorders. Onset is the difficulty falling asleep at the beginning of the night, and then maintenance is the ability to stay asleep, so you'll wake up during the night. It's caused by a lot of different things. So one thing it's caused by is there's neurotransmitters in the brain, and they create chemical interactions that will literally just keep you awake. Medical conditions such as nasal or sinus allergies, those will keep you awake. Gastrointestinal problems, endocrine problems, and then things like arthritis or like chronic pain will keep you awake because those things create discomfort, which basically just make it really hard to sleep. The consumption of alcohol, caffeine, nicotine, and heavy meals before bed will keep you awake. Anxiety or depressions because you're like worrying and you're overwhelmed a lot. Certain medications like steroids, anticonvulsants, and then dopamine agonists, those can keep you awake as well. And then sleep apnea is a condition where it's linked to insomnia, but it's where you basically stop breathing once you fall asleep, and this causes you to wake up during the night. So some of the risk factors are family history or hereditary. So basically, if your family member has insomnia, you are more likely to have it. People with depression, 80% of pregnant women have insomnia as well. People with higher level education, about 50% of people over the age of 60 have insomnia. Women are twice as likely to have insomnia as men, and then working night shifts and long range jet travel will also be risk factors. And then so there's a couple of different ways to diagnose insomnia, some including like filling out questionnaires, filling out sleep logs, blood tests, overnight sleep studies, which is where they'll hook you up to a bunch of different things, and you'll like go to sleep like normal, but they'll like monitor you while you sleep. So yeah, and they'll do physical exams as well. Some of the symptoms are difficulty falling asleep. You'll wake up during the night. You wake up earlier than you wanted to. You'll be tired during the day. You have mood disturbance, so you'll be irritated and cranky, stuff like that. You have very bad focus. You get tension headaches, or you'll have behavioral problems. So some of the treatments, so there's like a couple different things that you can do like at home just by yourself. You can have a sleep schedule and stick to it. Staying active, avoiding naps during the day so you can sleep at night. Limiting your caffeine, alcohol, nicotine consumption, and then try not to have like heavy meals before bed. There's prescription medicines that you can take as well, including Lunesta and Roserum. There's also over-the-counter drugs that you can take, but these have antihistamines in them that make you drowsy, but they're not intended for regular use. So if you continue to have sleep problems, you probably want to go to the doctor. And then some of the other things that they do are stimulus control therapy, and this is where they try to take out the factors that keep you from sleeping. They'll do relaxation techniques like breathing exercises and muscle relaxation, and then they'll do sleep restriction. So this is where you basically try to stay awake instead of trying to fall asleep, because this will take away anxiety or like worrying about falling asleep. So then I just have some of the statistics of insomnia. So 1 in 3 people have mild insomnia. About 1 in 10 people have chronic insomnia, and then at least 60 million Americans have insomnia. And most people experience some sort of symptoms of insomnia at some point in their life. And then here I just have a graph of the percent of adults who use sleeping aids. So it's about 4.1% of all American adults use sleeping aids, and then it has like a bunch of different age ranges. So okay, so then for my activity, I just did an insomnia questionnaire. So I started out with the age, the gender, and then full-time or part-time, and then employed or unemployed. So those would just be like giving us a general like what kind of people have it and stuff like that, and then or what kind of people have problems with sleeping at least. And then the following questions would be like the questions that they would ask you when they're diagnosing you. So like, how long does it take you to fall asleep? Do you wake up during the night? Do you feel refreshed when you wake up? Are you tired during the day? Do you have trouble completing everyday tasks due to drowsiness? So those are some questions that they would ask you if they were trying to diagnose you. So this is basically just an activity that would see if people have trouble sleeping, if they could possibly have insomnia. And then I also, for the takeaway, I just made a 1 week sleep log. So people could just like track their sleeping, see if they have trouble sleeping, just stuff like that. So that's it.